Many times we have patients with severe agonizing pains, and to understand a patient in the pain and to prescribe at that time needs skill of understanding the patient as well as right questioning and correlating with the materia medica. In a similar context, I have a case of a woman which is maybe 51-year-old. She came to me with a severe headache and she had been suffering with this pain for 35 years or so. She used to get these acute exacerbations very frequently. But this time, the story was that she was looking after a whole family who was down with a viral fever. She treated that influenza, took care of the family. In return, she gets this fever back. She suffers from the fever for a few days and then she ends up in a headache. When I asked about the location, she says it is in different parts of the head, mostly left sided, over the left eye, and the parietal region. The sensation was as if something is cutting through that. The typical migraine pain aggravations by slightest noise, light, slightest disturbance, better in dark room, all were perfectly present, which gave her the common totality. She said the pain is very excruciating. It's like a torture. Occasionally, it worsens and subsides and again comes back. So I asked her, tell me anything else that accompanies your complaints, any concomitants. She said she has frequent nausea and vomiting. But this time there was only retching, no vomiting. She used to feel better by belching, but couldn't eat. She had not had anything for last 2 days. The appetite was practically zero. The low-grade fever still persisted to around 99 degrees and extreme restlessness, tossing and turning in the bed. There was chill, heat, sweat stage which had been very prominent in every paroxysms, following one after another. The chill stage, she felt that as if the whole cold was coming over, and then the sweat stage would start immediately. There was a kind of chill that was accompanying the headache because the fever had already subsided. Now, 3 days of this fever, and again she gets into this severe migraine attack that makes her emotionally completely depressed. The depression was taking her like crazy. She had become completely hopeless, complete despair because the headache, which was there for 30 years after the severe influenza, had come with a severe agonizing pain. She said that this is like better that I should die. I do not have anything to look up to. Every time, frequently, I get into these problems again and again. She said this is a typical headache that she was having for last 30 years. She has tried many treatments, but nothing has helped. Only this time, the triggering factor is different. She has been getting these pains more frequently for longer durations over the years. It will last for hours together and then it would subside. But for this time, things have changed for her. Initially, the triggering factor, as we all know, would be getting out in sun, in that heated rooms, or the psychological stress, pressure, slightest exercise, exertions. This female was slightly hurried types. Means she wanted to do things very fast. A lot of her pains used to aggravate before menses, and over this triggering factors coming so frequently, she had now come to the state of hopelessness and despair that nothing would help her. As I described you the character of the pain, which was focused more from the vertex to the eyeball, increasing gradually a cutting sensation over the head. Okay. Now she said that most of the times the headache would be relieved by sleep, but this time she has tried sleeping and nothing was helping her. Now more and more sleep is required, but even if she sleeps, the headache is still present. It is not making her feel better. Now, what to do? I asked her some direct questions because I knew what she was talking about and what the remedy could be. I asked her that if she had some kind of dreams, and she said, yes, I have some kind of very frightful dreams during this part of the episodes. Then I asked her about the pain. Do you have any pain in the eyeball? And she said the pain is very severe. Both the eyeballs are paining. And that was very confirmatory for me. I prescribed her a remedy called Scutellaria lateriflora 1M. She took one dose, and just after a few hours she has taken some second dose, and after that the pain subsided and to never return back again. To prescribe this on a clinical basis requires some deeper understanding of this remedy. We know all this remedy is a very useful remedy for headache, but the peculiarity of this remedy lies in the way the patient tells you. It doesn't come from your repertorization generally. It comes from the understanding of the events that follow in a particular illness. If you see that this patient had gone through a severe viral fever, influenza, and after the influenza, she develops this headache. So, headaches followed by influenza is one of the indications of Scutellaria. Secondly, The very important thing is it is useful for nervous headaches. They say night terrors. These patients are basically nervous individuals who get affected by emotional traumas, frights. Those people who have emotional traumas or night terrors triggering their headaches, Scutalaria is a very good remedy, and in fact an excellent remedy for such cases. So you see, after giving Scutalaria, the patient recovered like magic. Within an hour, the headache stopped. But the most important part is to come to this remedy Scutalaria in clinical practice. When to think of Scutalaria? It is written in our Materia Medica that this is a very good remedy for school teachers' headache, people who are highly stressed, people who are overactive with their mind and mental work, people who are nervous by constitutions. If you read Boric, the first line says that nervous fear predominates. If you understand this line itself, a lot of the personality will come in front of you. It means that the person is one who has lot of fears, and that will be predominating. Now, if at all you have to know the fears, where do we look into? The most uncompensated area is the dreams. That made me ask the patient, tell me your dreams. And she says the dreams are full of night terrors, fearful, frightful dreams, ghosts, specters, etc. That is what the subconscious of Scutalaria is. So if you have to prescribe Scutalaria, you need to know that who is the person who needs Scutalaria. These are very sensitive individuals. Secondly, if you see headache after influenza, this was the right way set for this patient to go into the problems. She had an attack of influenza which precipitated into the headache, and then it settled over the left eye, then the pain on the eyeballs. So the direct question, tell me, do you have any eye symptoms? And then she says, yes, my both the eyeballs are paining. This is the sphere of action or the range of action of this remedy, especially in headache. It starts from right side and settles over. The eyeballs are severely aching. And in such conditions, especially nervous individuals who have fear that is predominating everywhere, which can lead to even chorea or twitching of the muscles, which can also cause a kind of convulsion, sometimes confusion. Okay, these kind of patients are very much suited for this remedy Scutalaria. This patient will always complain to you about restless sleep. They will always tell you about some stomach distress because of the restless night that they have. They will always have the night terrors and sudden wakefulness, twitching of the muscles. So, if you have to think of Scutalaria, especially of the headache, predominantly think of those individuals who are extremely sensitive, who are extremely fearful, and especially if you have an antecedent viral fever leading to an headache, settling over the eyeball, lot of fearful, frightful dreams, think of this remedy Scutalaria. Thank you.